Alan Alvarez on the radio, KPHI 96.7 FM. Hawaii's hot Filipino hits. It's the midday show with Alan Alvarez.
All right, mga kaibigan. What's everybody doing out there? Every day in Hawaii is a great day, don't you think, Doctor?
That's why I live here, my friend.
All right. And today we have with us Dr. David Behling. Okay, Dr. David Behling is a doctor here based in Oahu. He went to the University of Hawaii John Burns School of Medicine. Is that correct?
That's correct.
That's correct. You did your residency at Kaiser Permanente in Los Angeles, and you specialize in OB-GYN.
That's true as well.
That's right. You are an athlete, and you actually do martial arts training.
I do.
You do. And you actually undergo testosterone training, testosterone treatments yourself.
I do.
Okay. Let's welcome to the show Dr. David Behling. Hello, doctor. Welcome to the show.
Thank you, Alan.
All right. So, before we start, and, because I know you're here with your clinic and what you do, and before we get into testosterone, can you please tell us a little bit about yourself, your clinic, and what you do?
I was born in Chicago. I'm afraid to tell you how old I am, but I've been in Hawaii for the last 30 years, and I didn't start out as a doctor. I started out as a lawyer, believe it or not.
As a lawyer, wow. My wife is a lawyer.
Well,
yeah.
You must have one of the very few nice ones. Congratulations.
I'm well behaved.
But I realized a long time ago that I wanted to put my hands into people's lives and make a bigger difference for them on a more meaningful level. And so I went to med school. I left that profession after I practiced for 5 years here in town, and it's made all the difference for me.
Was it a hard transition from being an attorney to a doctor?
If I was to do it again, if I had to make the same choices, I would reverse it. It's much harder to be a doctor, in my opinion.
Right? Oh, yeah.
And I would have done it with a much younger, stronger mind.
Well, you seem to have a very good mind, and being a doctor and practicing. It seems to be okay. So far, so good.
Well, thank you.
Gauging from this interview.
And I started OB-GYN practice. Mm-hmm. I finished my residency up in 2009. I started my practice here. I worked up in Mililani at first with Dr. Bill McKenzie. Some of your listeners may know him. He's been a fixture around here forever. I think he's still practicing. He's about 77 years old. Mm-hmm. And it turned out that while I love what I did, I was exposed to testosterone replacement. And it turned out to be my passion. Why?
Right? Mm-hmm.
Because I discovered I had low testosterone myself.
Uh-huh.
I would come home every day from work, and if you know what OB-GYNs do, we deliver babies, and so we don't get real regular sleep. And I would come home and fall on the couch, sit in my regular position with my remote control, and I would just sit there and just pray that the phone didn't ring until I could get 4 or 5 hours sleep, because I knew that I didn't have anything left in the tank.
Mm-hmm.
My kids would come by and they'd laugh at me. "Dad, you're gonna fall asleep on the couch again today? If I had the strength, I'd grab you."
Sure.
And but when I was determined to have low testosterone, I replaced it. It made all the difference. It felt like I was coming back to life, honestly. Mm-hmm. I felt like I was an old, broken down man, and I was about ready to give up.
That is far from what you look today, doctor.
Well, thank you.
I'm telling you.
Thank you.
No, but before we get into that, I really appreciate what can you tell us what Life Restore MD is? Is that your clinic or?
Life Restore MD is our clinic.
Okay.
My beautiful wife actually thought of that name.
Sure.
And
Alexandra was here today with us. Hello, Alexandra. Thank you for joining us. Yeah.
And basically, it's a culmination of what we're trying to achieve. Mm-hmm. We have a slightly different focus on helping people in our clinic than the current medical establishment.
Okay.
Most doctors are unfortunately put into a position where they can only help people after something's gone wrong.
Oh.
Our desire is to make a difference in people's lives before something could go wrong, and hopefully prevent it while making their life more enjoyable.
Mm-hmm. So preventive medicine, before something happens, be prepared.
I think so.
Is that right?
I think so.
Is that right? Okay. And this is where you do your treatments and all the testosterone. How is testosterone? Is that an injection? Is it something that you ingest? Is it something that you take? How do you take testosterone?
There are many ways to get testosterone.
Okay.
However, as my clinic focuses on providing these services to people through their very hard-earned health insurance, and testosterone is generally only compensated through insurance through injection. So that's
injection.
Yeah.
Okay.
That's the primary mode that we use in the clinic. Although there are several other options, including creams.
Cream.
Yes.
Like
pellets,
you rub?
topical creams that can be
Is that
rubbed
right?
on.
Okay.
Yes.
What do you recommend? What do you normally do?
Depends on the patient.
Is that right?
See, and I don't want to get too far ahead of us, but women actually benefit from testosterone, the same benefits that men get, with slightly lower risks and risk of side effects, believe it or not. But for men, I recommend injections, and there's a very specific reason for that, aside from the financial concerns. Men have one surge of testosterone a day. We get it between the hours of 4:30 and 6 o'clock in the morning, assuming we've got about 6 to 8 hours sleep the night before.
Is that right?
That's exactly
Oh,
right.
I never knew. I never
It's
knew
true.
that. Okay.
You may notice some changes in the morning associated with that. And so we get a surge. It goes up and it comes down, kind of like a lopsided mountain, like that.
Is that right?
And so
throughout the day.
Exactly.
Okay.
Exactly. And when we get an injection, over the course of a week, it does exactly the same thing. Men like the surge, like to be, for a lack of a better word, elevated testosterone levels, and we're used to that, and we're used to coming down. Women, very different, actually.
Okay.
Women make their testosterone from a conversion of a small amount of their estrogen pool into testosterone, molecule by molecule. It's a very steady state amount of testosterone, and because of that, they actually benefit from having a testosterone pellet inserted under the skin of their hip. It's a very steady state transition of testosterone.
Pellet?
A pellet.
Oh, my
The size of a Tic Tac.
Is that right?
It lasts for 6 months for them.
Is that right?
It is.
And how long does one injection last for a guy?
12 days. But the injection pattern
Doesn't seem
is...
to be fair.
Considering that God gave the men testosterone to begin with, we have a little making up to do.
So we have more than a woman.
We do.
So that's probably why.
The normal physiologic amounts of testosterone vary significantly. Men's, well, let me say this: women's normal range is 2 to 44 nanograms per deciliter of blood. The units aren't important. Remember the number 44.
Okay.
Men's normal testosterone level, according to Medicare, is 250 to 1100 nanograms per deciliter
Is that
in their
right?
blood. Yes.
Oh my God, I never knew that.
Well,
Wow.
it gives men significant benefits with regards to when we're trying to get back into shape, for instance.
Sure.
We can, shift things into lean body mass a lot faster than women can. So we don't necessarily lose the weight, but we'll shift fat into muscle, and we'll get to where we want to be a lot quicker with working out, resistance training. And it's another large part of what we do, a little off topic, is weight loss at my clinic, and so I'm always explaining the difference to women about that.
Fantastic. Doctor, we have to take a break. You have time?
Oh, for sure.
Okay, great. All right, mga kaibigan, we're back, and we're talking about testosterone treatment, and just basically getting your strength back, and especially for men. Doctor, before we proceed, how can people reach you right now? Do you have a website or a phone number while we talk? Maybe you can tell them about it.
Oh, for sure. We have both. Life Restore MD, the clinic, we can reach that at 808 on Oahu, just regular, 585-0785. If you're outer island, put that 808 in front. We also have a website where you can find some information about all that we do. Our website is Life Restore MD, just like it sounds, LIFERESTORE, MD is in medicaldoctor.com.
Thank you very much, sir. And then, if you have any questions, for Dr. Behling, while we are doing the interview, so please call 526-1180, 526-1180, and you can ask. I asked Doctor if there's any things we can't talk about. He's open. If you're feeling something and you want to ask Doctor, just call right now, or during I'll be looking at the phone prompt, 526-1180. All right, Doctor. You mentioned injections and needles and those type of things. People get a little bit scared, when it comes to needles. Is it a big needle? Is it a small needle? What kind of needle are we talking about?
No,
Yeah.
I mean, if you want to look it up online, it's a 25 gauge, 1.25 inch long needle. Okay. And
is that a standard needle?
it's a very standard needle. It's the smallest needle that you'll ever give an intramuscular injection through. Just so that you know, I do have a whole crew of guys that like to give it subcutaneously, which is the tiniest little insulin needle. If you have an uncle or a grandfather who might be unfortunately dependent on insulin, same size needle, 31 gauge needle, the smallest, the needle they use to draw blood from babies in the ICU, the NICU. And so we can do that transdermally as well. So we've got lots of options, but I will say this. There are no men that I have met in the last years of my practice that are, regardless of the fear that they present with, that cannot learn to do it themselves, and they all do.
Oh, really? Self you can self-inject.
Oh, for sure, for sure. We work with people. We teach them the very first day. If they want to have us give them the shots, we've got a couple crews of guys. They ones that come in every week because it's convenient for them. But let's face it, it's a heck of a lot less painful to give yourself your injections than it is to drive in from Waianae or Makakilo.
Sure.
It's into my clinic every week. So
Sure.
we have them come in once a month, get one shot there, make sure no changes in health have occurred, and then they take the other 3 injections for that month home.
All right. So there you go. So you don't have to be afraid. Hindi kayo kailangan matakot. It seems like it's going to be painless. I mean, I've taken injections and it really doesn't bother me. So, all right. One question, doctor, that I talk to some friends, of course, me, I have, thank God, I still feel energetic and I still feel
Thank God.
okay. Yeah, thank God. But some people ask, how do you know if you're just tired or maybe you've just worked a little bit too hard? Or, how can you tell if it's time for you to get testosterone treatment?
My recommendation is that any man over 40 should have his level checked. Okay, that's number one. To
so
screen.
you can check your level.
Oh, for sure. Blood tests. So we can order those blood tests for you. But there are symptoms of low testosterone, and they fall into 2 main groups.
Okay. Tell us about that.
Well, the first main group are the mental symptoms. Okay? Mental, for sure.
Okay.
These are the most important symptoms.
Okay. Tell us about that.
Energy. Energy is the first most important mental symptom. It's not physical. It's your motivation to accomplish goals. Our testosterone level is directly responsible for the size of our energy pool. As that level drops, our energy pool shrinks. Now, most men will strategize by putting their work in the center of that energy pool because that's how we pay our bills and we take care of our family.
Got that right, doctor.
The problem with that strategy is that we lose motivation, our energy to accomplish other things. Okay, we lose motivation to do our athletics, motivation to do our workouts, motivation to spend time with our friends.
Okay.
Then we lose motivation to do important things, spending time with our kids and grandkids. Meaningful time with our wife can take a bite of that. It can even shrink underneath our work, and our work performance can start to fail, and that can be very dangerous. People who work construction with big equipment, police officers, air traffic controllers, prison guards.
How about manual labor guys?
Oh, for sure.
Doing lawns,
these guys are
cleaning out, home.
You make your money dependent on your motivation to get out to work, and if that motivation shrinks, they're going to find someone who hasn't lost their motivation yet. And what I do, that's why we call our clinic Life Restore. We replace that testosterone. We refill that energy pool. So not only can we do our job right, but we have motivation to accomplish all those other goals.
So it's not just you're tired, like from a hard day's work. It's not, something like that. Or
no, this is people associate the symptoms of low testosterone with getting old, and it does. No, we can get old without feeling old, and that's the difference.
Oh, I would love that, man.
Now, the other mental symptoms are important too.
Uh-huh.
Decreased libido. Sometimes people with lower testosterone will have a decreased desire to be intimate with their partners.
Having sex, you mean?
Yes, sir.
Okay.
Yes, sir.
Okay. Let's get into that.
All right.
Sometimes, some men, when they think, is it because maybe they've been with their wives too long, or maybe they haven't gone on vacation, that type of thing. How do you tell, doctor?
It's the saddest appointment I have when a man comes to me and he tells me, I didn't want to have sex with my wife anymore. We broke up, and I found my girlfriend. We were excited. I've been sexual with her for the last 8 months, and now I feel the same way about her. All right. If he would have came to me before, I could have saved that marriage. Okay?
Is that right?
For sure.
So you mean he found a girlfriend?
Found a girlfriend. It was exciting for a little while. And he blamed his wife. I wasn't interested in her, but it's the low testosterone that he didn't have the desire to be intimate.
Is that right?
It is.
Oh my God,
and sometimes it goes the other way. The man doesn't have the same interest he had when he was 25, 30, 35.
Sure.
And the woman is convinced that he's with somebody else.
Well, that's what I would think, that maybe the man would feel like, I need a girlfriend, or I would like a hotter or somebody more sexually attractive. But even then, you're saying that because of low T, even if you have that hot girlfriend, you still experience that decline.
I can give you my own personal example.
Oh, man. If you don't mind, doctor.
Well, my wife is 11 years younger than I am, and when I was first going through these symptoms,
You're so lucky, doctor.
Well, thank you. When I was in my early 40s, I was first diagnosed with low testosterone when I was 42.
Is that right?
All right, I had the testosterone of a 74-year-old man.
Oh my God.
216 nanograms per deciliter.
That's even possible?
For sure.
Oh my God.
I've met several men with lower, believe it or not.
Is that right? At younger ages?
Yes.
Oh my goodness.
Yes.
Wow.
And so, we would go 4 weeks, and then she would say, you want to be intimate tonight?
Sure.
You want to have sex tonight? And I would say,
You get that
honey,
nudge.
I've got surgery tomorrow. I really can't. How about we do it tomorrow when I get back from the OR? Okay.
Sure.
Because
sure.
I didn't have the desire, but I knew I had to meet that need for her. She's going to go find someone else. But the other problem I had was that I knew that I couldn't perform. Okay, because there are physical symptoms associated with low testosterone as well. And for me, erectile dysfunction was one of them. There are two other mental symptoms I'd like to point out because
go ahead, doctor.
Almost universally men are suffering these and they don't know.
Okay.
Depression. Men with lower testosterone will suffer increased rates of depression. Now, men typically don't cry in the corner when we get depressed. What we do is we get anxious and we get angry a lot faster than we used to at things that didn't bother us before. All right?
Is that right, doctor?
Absolutely.
I can't. These are all very these are like revelation type things
because
to me.
Without the testosterone, we lacked confidence in who we were, and so we worry. When we replace the testosterone, we get that confidence. We're strong in our skin again. We feel comfortable again like that, and we don't sweat the small stuff. Road rage, classic example of low testosterone. All right, impotent yelling at someone 5 cars away who doesn't even know you exist.
Doesn't even care.
Doesn't care at all.
Yeah.
Right.
But to you, you feel like
exactly.
Yeah.
Now, the last mental symptom was the one that bothered me the most. It's insomnia. I slept so shallowly because my testosterone was low. I'd wake up every 2 to 3 hours at tiny noises that other people wouldn't be bothered by. And if you get woken up enough, it would take me 30 minutes to get back to sleep. You wake up in the morning as tired or tireder than you went to bed. Because you didn't get into the deep enough sleep. I had a man sitting in front of me a couple months ago who told me I can hear my cat walk.
Oh, my Lord.
And I was like, oh, man, that's a rough one.
Oh, my goodness.
Now, the physical symptoms of low testosterone, decreased strength, decreased endurance, decreased erectile function. Now, on a scale of 1 to 10, with 1 floppy like a dish rag, 10 as hard as a rock, and 7 just enough to penetrate, guys with low testosterone and no other cause for their erectile dysfunction will generally have an erection between 6 and 7.
Is that right?
That's right. Once we replace that testosterone, we're back to 8 to 9 out of 10 every time again.
12 o'clock noon.
There you go.
Is that right?
That's right.
Is that right?
Yep.
Yeah, no, 12 o'clock noon. That's fantastic.
Now, the last physical symptoms are increased recovery time from heavy activity. So a man with lower testosterone might need 2 to 3 days to recover from heavy work or a heavy workout, whereas before he would recover in 12 to 24 hours. And so that makes it tough to get out and do those physical jobs again if you're still suffering, from the workout or doing the heavy lifting and loading and all that stuff that you used to be able to get up in the morning and feel good again. The last physical symptom is related to that. It's the inability to build muscle. Once we reach a certain point,
that right?
Yeah,
that's all related to testosterone.
Well, yeah, we don't have the physical, the hormonal fuel to build muscle anymore. We can work out, and we're not seeing the results in the gym anymore. Now, you can maintain what you got with low testosterone if you work out super hard, and I'm talking like an hour a day of resistance training. But if we replace that testosterone, you'll be able to build muscle again if that's one of your goals. Okay, now and that's more than just being Arnold Schwarzenegger in the gym. People with chronic illness, okay, particularly diabetes, the more muscle mass we have, the faster we can burn through that sugar with the same amount of exercise.
Okay, I have a question. Are you more susceptible to disease if you have low T? If you have low testosterone, are you more susceptible to diabetes? Are you more susceptible to cancer? Does it give you strength to fight these diseases?
Yes.
Wow.
There was a great study that came out done by the Veterans Administration in the 90s that said men with low testosterone, all right, have a 68% increase in all causes of mortality.
Oh, my goodness.
All right. Wow. In particular, there was a study that came out in 2015 in December that showed that adequate testosterone replacement for patients would decrease their daily average glucose level by 12 grams. All right, which is
And what
major.
does that mean?
That means that
Sorry,
sure.
I'm a layman. I'm
no,
a DJ.
No worries. Sorry. They've increased their muscle mass and their motivation to do activity with that muscle mass, so they're doing what their doctor asked them to. They're getting out there, they're doing their walking, they're doing their treadmill, they're keeping their sugars down, and they're going to be able to fight that disease, because I promise you, someone's going to win. It's going to be you or diabetes. Let's make it you.
That's so great, doctor. I didn't... Anyway, sa lahat ng mga baka kayo po ay may sakit or you're experiencing some disease that... if you have any questions, give us a call, 526-1180, 526-1180. We have here Dr. David Behling with the Life Restore MD Clinic. You can reach him at 585-0785, or you can go to the website, liferestoremd.com. liferestoremd.com. Another question, doctor. How do the women feel when their man is, experiencing low T? How do they do women find it, like, for the lack of a better term, a turn off? Does it, make them look at other men? Does that, how do women handle a man with low T?
It's many factors.
I don't know if Alexander
this.
wants to answer that.
Do you want to answer this one, honey?
Huh? Yeah, you want to, from a woman's point of view?
I can only speak from the man's point of view.
Go ahead. Either way.
From the male point of view, and I've heard this time and again, both from my male patients and also their wives that accompany them into the clinic, because those are the most productive visits, when the partner comes in with the patient.
So would you recommend they come in with their wives?
If they can.
Or girlfriends?
I absolutely
Not
do.
wife and girlfriend.
Yeah, probably would pick one. Come in with the wife.
Yeah, come in with the wife. Okay, go ahead.
And, because number one, women always ask the smarter questions. All right. They honestly, the men hear, I'm going to be stronger. My penis is going to work again.
Sure.
Sign me up.
Very easy.
And women are like, what are the side effects?
Right.
How much is,
right.
How long is this going to take? And they will keep the man on course. And
turn him into a jackhammer.
Well,
can't turn him off, Yeah, right?
What a tremendous.
That was the problem with the Viagra before. They couldn't, like hours to go on. The women couldn't take it anymore.
Well, it's, once, and I also say this, when the woman's there, they also hear all the other benefits that have come along, because they think they've just married to this guy who's getting a little pudgy around the middle, doesn't want to do anything with them anymore, isn't interested in sex with them, and is grouchy.
Wow.
All right. And then when they hear all these things that we're going to improve for them, the women are dragging the guys into the treatment room to get the first injection, and they will come in and they will say, we can have a conversation again, and he doesn't just snap me off or tell me it's not important.
Sure.
We give them the ability to relate to each other again many times.
So not only does testosterone cure or restore, it's a great term, by the way, restore the sexual power or energy, but it also even assists in the relationship in many ways. Is that what you're saying, Doctor?
I've seen it many times. Yes, absolutely.
Okay. Does it give you increased size in any way?
It will give you the benefit of the full size God gave you.
Is that right? Oh my God!
It won't increase that size.
Really?
But it'll. 97% of my patients will achieve satisfactory and above satisfactory erections when they didn't have those before the treatment.
Is that right?
Let me say 95% will. The last 2 to 3%, sometimes if there's injury from diabetes, that has compromised the blood vessels that feed blood into the erection, we can overcome that for the next 2 to 3% of those men to get it up to about 97.5% with Viagra or Cialis.
Now, okay, we got to take a break. Excellent conversation. My God, it's just really informative. Again, ladies and gentlemen, all the listeners, if you have any question, you're not going to charge for consultation, will you?
No,
Doctor?
no.
Okay, all right. So this is all a free consult. If you have any questions for Dr. Behling, kung meron po kayong nararamdaman na mga pinag-uusapan namin, okay, if you're feeling anything that we're talking about here, now's a great chance to ask a question. And 526-1180, we are live. So dun sa mga live, if you have any questions, just type it on the live. We're going to take a commercial break, and when we come back, we'll be with Dr. Behling talking about the importance of testosterone. Huwag kayong aalis mga kaibigan, huwag kayong bibitiw. We'll be right back after this.
Are you over 40 and more concerned with the cost of living than the cost of your health or sex life?
Do you have a personal or family history of diabetes? A major contributing factor to erectile dysfunction is uncontrolled blood sugars. If left unchecked, this could lead to erectile dysfunction, which even Viagra and Cialis cannot correct. Whether you are suffering from loss of energy, strength and endurance, or performance issues in the bedroom, it could be part of a medical problem like low testosterone. Unfortunately, testosterone clinics can be expensive. Until now. I am Dr. David Behling of Life Restore MD. We are a hormone and lifestyle optimization clinic and Hawaii's only medical clinic specializing in testosterone replacement therapy and ED treatment that accepts medical insurance. If you are a candidate for testosterone replacement therapy, you may be completely covered.
For an appointment, call Life Restore MD at 427-1976. That's 427-1976, or on the web at liferestoremd.com. We're in the Pan Am building on Kapiolani Boulevard.
All right, guys, we're back, and enjoying this very nice interview with Dr. Behling and the Life Restore MD clinic, liferestoremd.com. And if you want to call us, actually, if you have any questions, 526-1180. And if you want to call Dr. Behling, it's 585-0785, 585-0785. Okay, doctor, so we've got basically halfway through our interview here, and one of the questions actually I also had in my mind was, are there any side effects to taking testosterone? Are there any negative results that could happen?
You know, this is medical therapy, and, you know, just let me throw this out there as a public service. Everybody knows somebody who's gotten it from someone other than a doctor. So, yes, there are risks associated with this, particularly if it's not supervised by a doctor.
Okay.
Now, there are 5% of men who should not use testosterone therapy unless they're cleared by a specialist.
Okay.
Now, these conditions are if they've had a previous heart attack, if they've had a stroke within the last 12 months, if they have untreated sleep apnea, well, that's where people have trouble getting enough oxygen when they sleep at night. If it's treated, if they're using their machines or you had surgery or lost weight for it, that's fine, but they need to treat it. If they have a history of leukemia, if they have a swollen prostate or prostate cancer, or if they've ever had liver failure, kidney failure, heart failure. I have many patients like that shouldn't stop you from coming to see me. We will identify these issues, and we will get the right clearance letters generated so we can get you back to the doctors who have taken care of you and get their okay to give the treatment. All right.
I see.
Now, 95% of men will never have any of these conditions. And then we move on to the risks of the therapy. There is one risk of testosterone therapy I make sure all of my patients know about. It's called polycythemia.
Polycythemia, okay.
This is an elevation in the normal amount of red blood cells in our blood.
Oh,
all right.
okay.
Now, our blood is mostly red blood cells. It's the normal amount of red blood cells are 40.1 to 50% of our blood being red blood cells.
Okay.
Testosterone is a growth factor. Right, it'll cause our muscles to get bigger if we exercise. It causes our bones to get stronger if we take it for 18 months or longer, and it causes our red blood cell count to increase. It's how we get the endurance benefit out of testosterone.
So you mean you'll gain more muscle when
sure.
you do testosterone?
Oh, absolutely.
Even as you get older.
Yes.
Yeah. Well, I can see, doctor. You use it. You work out. You look like you're in great shape.
Well, thank you.
Yeah.
So
that helps to get you
absolutely,
stronger.
Yeah, absolutely.
Does it help in overall? Like you get a better tan. You get overall. I'm not talking about just one area, sexual energy.
For sure.
I'm talking about. This sounds like testosterone is something that can help you all around. It's not just something to keep.
Absolutely. I mean, if you look at who has the majority of testosterone, the national average, and in fact the world average for the peak testosterone levels are men between the ages of 18 and 25.
Oh my God!
Yeah, so,
I'm way past that.
and unfortunately, we lose 1 to 3% per year. And like I said, the common thinking is to associate these changes that we feel as we go past our 40s, get close to our 50s, even further than that. I'm just getting old. I have to slow down. Testosterone will not make you a Superman, but it will make you the best man you can be.
Wow! At any age.
Yes, sir.
Is that right? So you don't have to be old. You can be past the 25 years, or can you also take it if you're...
I have a number of patients under 30 who have decreased low testosterone levels for a number of reasons. And so, yes, any man with low testosterone really should have it replaced for the health reasons we've talked about, but also to improve the quality of life.
Sure. How about, we were talking earlier on the break, Alan here mentioned something about those with some bone problems. As we get older, of course, is it osteoporosis? Is that what it is?
Well, sure. That's the thinning of the bones.
Thinning of the bones. Does it help? Help that in some way, and other effects of getting old.
Testosterone can definitely increase bone density. Now, it's not as strong as estrogen. Estrogen and testosterone are very similar molecules. Women have the majority of the estrogen. They're very similar, even though they do different things. But it does make bones denser. Yes. After you use it for a long enough period of time, about 18 months.
Okay, now many of our listeners are Filipino. Maybe they're not. I know many people are. They're tuned in. There's many people tuned in. Is there any is it not good for a certain race? Is it better for this type of culture, or is it something that can improve? If you're a man, this will help you.
God only made two people, Adam and Eve. And all those with Adam, as an ancestor, need to benefit from testosterone.
Is that right?
That's right.
Okay. All right, doctor. So, again, you were recommending it just to come in and get a checkup. What does that involve? Is it something quick that they can come in? How do you... Is that a complicated process? Men, they think they go to the doctor, it's going to be hard, it's going to be difficult, I'm going to be afraid. What can you say to the men out there to at least just check to come to Life Restore and then just check their blood?
Well, the first thing I can say is there's hundreds, if not thousands, of men who have already had it done, so you're behind.
Oh, okay.
Number two, though, is we do our best to streamline this process.
Okay.
There is required a blood draw, and we can do that in the clinic.
Okay.
It's best to get your testosterone checked before 9 o'clock in the morning. So when new patients come to us, we always offer them the earliest appointments. We start taking patients in at about 8 o'clock. Now, you don't have to come into the clinic before 8. If you want to come in after work, we can absolutely do that. And then we just give you a lab slip because the actual testosterone check does require a blood draw. Now, when you're in my office, you'll meet my staff. You're going to meet me or some of the people I have helping me to take care of you. We're going to take your history, do a physical if necessary. We're also going to tell you everything that we want you to know. And unfortunately, I haven't been able to get everything that testosterone can do or how we administer the treatment or what you can expect and in what time frames, but we cover all of that during the consultation. Most men can get in and out of our office for the first visit within about 45 minutes to an hour.
Okay. And you recommend that they come with their partner?
If you can, and you're absolutely welcome to do that, and I think it'll be best.
Okay, now, one question. Now, we're talking about more heterosexual men, but, there's a lot of, of course, there's homosexuals and how does that work in that situation if you have two men taking testosterone at the same time?
They're very happy.
They're very happy.
They're very happy.
Okay, so this really just it just kind of solves a lot of problems, not just for heterosexuals, homosexuals, those who are in marriages. Could it happen in a gay marriage that the low testosterone can affect the relationship?
I think it will because testosterone doesn't just, as we've talked about, doesn't just affect our physical abilities. It affects our mentation, how we handle stress, how we relate to our partners, how much sleep we're getting at night. And when these things are off, we're not the same person that our partner has come to know and depend on.
But do they change? They become different people?
Well, they become very difficult to deal with, where before maybe they weren't. They're willing to do less to support their partners, generally with regards to home chores.
After they take the treatment.
Do
they change their personality? Did they become like, hey, this wasn't the person I married? Or
the
this wasn't...
overwhelming comment is, this is the person that I've used to know.
Oh, yeah. That's so great, doctor. That's so great. So it can help really just troubled marriages, troubled relationships. How about at work? The better performance at work, or you laugh?
No, it's just I'm just reliving these moments I have with my patients. I had a guy.
Well, I haven't. Like I said, I'm coming at this like I don't know, so I don't really know.
I have patients tell me all the time they're able to increase their performance, and not physical jobs for sure. Okay.
How about mental work?
Well, for sure, it improves focus and mentation, and they're able to not only continue to do their job well, but improve the speed that they do it so that they can get home earlier sometimes if their job allows them
Go
to do that.
surfing, man. Go out in the sun, go on the beach.
Then when they get home, then they're not just like I used to be in my position on the couch with the remote in one hand till I
Beer
fell
in
over
the other.
sideways.
Yeah.
It's they're getting out and they're doing what they used to do. The whole reason that they were working in the first place is to have the resources, not just money, but time to enjoy what they worked for their whole life. And that's really what Life Restore MD is about. We struggle to get into a position where we have the time and the resources to spend some of our year in what we enjoy, and then our bodies abandon us. I want to bring that body back. I want to give you the opportunity to enjoy what you've worked so hard to build.
Can you overdose on this thing?
Well, without proper medical supervision, absolutely. I mean, too much air is called a hurricane. All right, so yes,
Sure.
you know.
Now, have you ever had a situation where a guy comes to you, he's married, they're having a problem, you fix them or you restore, and then they feel so much sexual energy that they go out of the marriage to get, that type of thing, or does giving them the right amount of testosterone nurture that relationship so he does not have to go out of the marriage to get that?
I have never heard that testosterone broke up a relationship. The vast majority of troubled relationships are improved significantly with testosterone therapy. So I haven't heard that as a problem or a concern.
That's great. Like, sometimes they just can't control themselves anymore. It's not that kind of thing, right?
No, while I'll give you back some of your physical capabilities and the energy when you were younger, you still get to hold on to your 40, 50, 60, 70-year-old wisdom.
Oh, yes, of course. Okay. Yes, of course. Now, is there a maximum age that you can take the testosterone?
There really is not.
Really? Even if you're like 70?
I've got patients over 70.
Yeah? Is that right?
Yes.
And they're still at it?
They're still enjoying their life.
That's fantastic. I'm going to see you, doctor, when I get to that age, man.
You're very welcome.
I'm going to put you on speed dial when I become. All right. We're nearing the end of our interview here, so let me just ask a few questions that maybe as far as administrative and things. So, do you accept insurance?
Oh, absolutely.
You take all major?
We take all major insurances. In
HMSA, HMS, I don't know what are the other ones. All of them.
We're credentialed even with Quest and Medicare.
Is that right?
Yeah.
You take all of them?
We
even
do.
Medicare?
Even Medicare.
Oh, wow.
Yeah.
No, that's great news for all the older. Yeah, we have a Medicare program here, so we'll reinforce that when it comes up. How about those who don't have insurance?
Well, in that case, we can't take your insurance. We do take cash for our services, although the vast majority of our patients are insurance holders, and we do try to keep the cost as low as humanly possible for our cash payers, and I think we do achieve that.
Do you need a referral from a primary care provider for this, or can they just come and see you, or how does that work?
Most insurances do not require that.
Really, for testosterone treatment?
Yes.
Really, so anyone can just come to you and say if they have HMSA or any kind of insurance? Absolutely
true. Now, our staff is very well trained by my wife, who there are a couple insurances who do actually require a referral, by far the vast minority of them, and they know how to address that. It's just tell them what kind of insurance you have when you make the call, and they can give you guidance.
Okay, and for those who sometimes they don't have insurance, but they have a little bit. Do you have like a payment plan for those people?
We pride ourselves on making it as affordable as possible. So for our cash payers, we do not require them to sign up for any extended length program. We can go month to month.
You can go month to month.
Yep.
Okay. All right. So again, doctor, I want to thank you. Can you tell people again how they can reach you and how can they get in touch with you?
Absolutely. Please, on Oahu, give us a call at 585-0785. If you're calling from the Outer Islands, just put an 808 in front of that. Our website, which you can provide a lot of useful information, you'll find at liferestoremd.com. That's LIFERESTORE. MD as in medical doctor.com.
Okay, let me just ring that up. Let me see. Life Restore. Let me just take a look at it. Right, Life Restore. I want to make sure when I'm telling people to go that I know what I'm talking about, so I can. All right, Life Restore MD. Is that it?
Well, just
no,
one.
sorry. LifeRestoreMD.com. Wow, very nice website. Very nice.
Thank you. It's designed by my wife.
Oh, very nice. Very nice. Okay, so here you can learn about... Oh, also for women.
For sure.
We didn't talk about women here. That's so unfair.
Yes.
What happens to women when you treat them with testosterone?
Believe it or not, women get the same benefit as men do from testosterone, but with significantly lower risk of side effects.
Is that right?
Absolutely.
Do they get more like a cougar? Is that...
Well, they'll get the same mental benefits.
Is that right? How about physical benefits?
Yes, and that's many of my female patients elect to try testosterone therapy. And by the way, it's at 1/30th the dose that men would get. Because they're trying to lose weight, and like I said, we do a fair amount of weight loss at my clinic as well.
Okay.
And men have a decided advantage over women with regard to the testosterone. Even men with low testosterone have 3 times as much testosterone as women do to drive what they eat towards their lean body mass. So men will achieve the shape that they want significantly faster than women. Just to compare it, women have even a young woman, a 20-year-old woman, has a testosterone of a 100-year-old man. Right.
Is that right?
And so when we're trying to lose weight and do body sculpting for women, we add a testosterone pellet. If I was to do this for men, I would do 10 to 12 pellets. And in 6 weeks, they are able to build muscle better than they did when they were in their 20s, and it really helps them. They also get the mental benefits. So we're talking about increase in energy, which a lot of women after their last menstruation will suffer from because, as I said, women make their testosterone from a small amount of their estrogen pool. When they lose their estrogen at menopause, they lose that small amount of testosterone, and they lose motivation to get into the gym. So that's when they need it. But when we replace it, they get the motivation. They have the increase in libido. Now, some women don't like that, but the vast majority, I'd say over 90% of the women, are very pleased with the result of an increased libido. It brings them closer to their partner, too. It elevates their mood, and it helps them sleep sounder as well.
It doesn't cause, do they grow hair? It doesn't. It doesn't make them more masculine, right?
It doesn't androgenize them. When I get the women to the treatment level, they don't grow hair. They don't get an Adam's apple. They'll never be able to beat their husband arm wrestling unless they can beat him now.
Okay.
At most their testosterone is approximately the testosterone of an 84-year-old man.
Okay.
So they'll never be any of those androgenation issues.
Okay, I see that we have Mr. Frank Igno listening here, and he's the one that absolutely does not need it, but could possibly have advantage for it. I also want to say hello to Consul Joy Santos, who's also tuned in from the Philippine Consulate General. So thank you very much, everybody who's tuning in on the Live na Live. Doctor, I want to thank you, man. This is just so enlightening for me as a man. And I think if I felt that, I'm sure many people out there felt it as well. Very easy to talk to, the doctor. And I think it would be to an advantage to everybody out there, men, women, straight, gay. It's just, if you're feeling something, low interest in everything. You mentioned menstruation. Does it help? Sometimes, the women, they get these migraines. Does it help with that?
There are other things that I can do to help a lady who gets migraines with menstruation.
All right, another thing. Before we end, what other services do you have at your clinic?
The majority of the other services we offer are kind of focus on the same bent to improve your life. I mentioned weight loss. We have a medical weight loss program that's supported with appetite suppressants, but more geared towards teaching you a new lifestyle so that once that weight is gone, we're able to keep it gone. All right.
Weight control, weight
control,
loss, weight management. Okay.
We offer body sculpting. People who don't necessarily need to lose weight, but want to increase their lean body mass. I have several professional bodybuilders, as well as bikini models, who have benefited significantly from some of the strategies I use for weight loss, but keeping them calorie neutral and giving them hormonal testosterone or growth hormone to increase their lean body mass without losing weight.
Bikini models.
For sure.
I like that. Are you sure it's not the bikini models that give their energy back? Not the testosterone?
Everybody has their own benefits. We do offer growth hormone therapy at the clinic
right.
for people who, not just to increase lean body mass, although it is a 3 times better muscle builder than testosterone, but to heal connective tissue injuries. Because unfortunately, everything that testosterone will do for you, it really doesn't impact our connective tissue, the cartilage, the ligaments. The growth hormone therapy can improve that, so we can help with that as well.
Is that like stem cell?
Stem cells is along those same lines, although we don't offer it at the clinic yet, but it is something we're researching.
Yeah. Okay, Dr. Behling, David, if I can call you
Please.
that. Thank you so much, man. Again, invite our listeners, invite everybody out there to come see your wonderful clinic.
Thank you, Alan.
Invite them if you can invite them all.
Oh,
Tell them to
please.
come, yeah.
You know what? It's my privilege to be able to serve the people of Hawaii, and I really do look forward to you coming in.
Where is your clinic?
My clinic is right now in the Pan Am building, and it's going to stay there. I just signed a new lease.
Nice location.
We're at 1600 Kapiolani Boulevard, 1600. Presently, my office is Suite 500 on the 5th floor, but starting May 1st, we're going to be in a suite twice as big on the 8th floor, room 817.
All right. Okay, doctor, thank you so much. If you want more information, please call him. Very knowledgeable, very helpful, I think, if you're suffering from any of these low energy or maybe relationship problems. You don't know. You don't know until you see the doctor, right? It may be the cause of your relationship problems. Please give him a call, 585-0785. The website is liferestoremd.com, liferestoremd.com. And on behalf of HOI Media Doctor, KPHI, and everybody here, thank you for coming down and sharing your wonderful knowledge with us.
I appreciate the opportunity.
It was a pleasure to get to know you, and hopefully we'll see more of you in the future.
I look forward to that.
Talking about how men and women and everybody there can improve their lives.